Hello everyone, welcome to our presentation Phase Security Analyzer for Next Generation Personalized Smart Healthcare System, which is recently got accepted in IEEE International Conference on Digital Health 2022. The paper is authored by me, Nur Imtiazul Haq, and Dr. Mohammad Ashikur Rahman. So these are the contents that I am going to cover throughout my presentation. At first, I'll give a very short overview of the smart healthcare systems and personalized smart healthcare system to clarify the actual motivation of choosing the problem domain. After that, I'll illustrate the proposed framework, and at the end, I'll demonstrate the main experimental results before concluding the presentation. The contemporary healthcare system is going through a swift transformation to handle the ever-growing healthcare needs with the advent of the connected healthcare systems. However, the ongoing pandemic period has drawn the light to the fact that contemporary telehealth and mHealth services of digital healthcare system require more automation to deal with a transient increase in treatment demand. For instance, during this pandemic, a substantial number of patients were delayed or denied healthcare services due to a significant disparity between hospital accommodations and demands, which contributed notably to the rise in COVID-19 related deaths. Nearly 48% of Americans affected with COVID-19 were either delayed or denied medical treatment, and this treatment latency caused 11% of them to have worsening health conditions. The global acceptance of automated smart healthcare system would have certainly reduced such unexpected events by adopting and enabling automated remote patient monitoring and treatment. The smart healthcare system concept redefines the modern healthcare system by merging an Internet of Medical Things enabled network and an automated control decision system to make it more personalized, automated, and effective. In a typical smart healthcare system, patients are treated automatically via implantable medical devices or similar automated medical delivery systems like heart pacemakers, drug infusion pumps, etc. A control signal, which often generated by a cloud-based controller to patients' vital sign measurement processing, is used to trigger medical actuators such as the implantable medical devices. The controllers employ knowledge derived from the domain experts' years of expertise to identify the patient status based on vital sign measurements being obtained from patients' body sensor devices. Through the Internet of Medical Things network, the body sensor measurements are relayed to the controller. Although the Internet of Medical Things enabled smart healthcare system can be a game changer for an ameliorated healthcare system, the open Internet of Medical Things network communication is growingly increasing the possible cyber attacks in safety critical smart health system. A recent study highlighted the viability of attacking healthcare sensor equipment, stating that more than 2/3 of Internet of Medical Things connected devices are vulnerable to several hacks. Moreover, the smart healthcare system is susceptible to many threats as found in recent literatures, including the man-in-the-middle attack, the MedJack attack, the hardware trojan, denial of service attack, civil attack, and so on and so forth. Between October 2018 and October 2019, the adversarial attacks hit more than 50% of healthcare institutions. According to a source, the University of Vermont Medical Center was cut off from the internet owing to a cyber attack which caused a $64 million loss. Statistics have identified the susceptibility of Internet of Medical Things enabled smart healthcare system with 6.2 vulnerability score in 15 to 20 connected Internet of Medical Things devices. So in the light of these events, a measurement manipulation attack is not too far to take into action, which can cause life-threatening events for the patients being treated with the connected smart healthcare system. Hence, developing a robust smart healthcare system with preventive and reactive measures is crucial. The smart healthcare system is mostly augmented with personalized healthcare for improving the patient treatment through obtaining knowledge about the individuals. The personalized healthcare, also known as personalized medical medicine or precision medicine, is a rapidly developing area where the doctors employ diagnostic tests to determine which medical treatment are appropriate for each patient. Despite treatment benefit, incorporating personalized healthcare can enhance the security of the smart healthcare system. In this work, we aim to demonstrate how adopting personalized healthcare along with an smart healthcare system build a robust healthcare system. We propose personalized health analyzer for security enhancement or phrase framework that can perform real-time security analysis of a personalized smart healthcare system. Our considered smart healthcare system incorporates a rule-based knowledge base where the rules related to the patient status identification, medication decision, and healthcare policies are acquired through years of experience of the healthcare providers and healthcare data analysts. We consider a sophisticated attacker with access to massive amount of healthcare data that can partially or fully learn the data distribution of the healthcare rules. The proposed framework uses a satisfiability module theorem-based optimizer to produce optimal attack vectors. The attack vectors are basically the required measurements to be injected into actual measurements for altering the patient's health status with the intent to evade the control verification. However, using the knowledge acquired from the personalized data analysis, our proposed framework can reveal several attacks. A knowledgeable attacker, having complete knowledge of smart healthcare system architecture and measurement verification process, can still launch a stealthy attack by misinforming the smart healthcare system controller. Thus, the patient will be mistreated. We consider the critical measurement can result from measurement manipulation attacks as vulnerable sensor measurements. The phase framework can identify vulnerable sensor measurements in real time and notify the healthcare provider. Accordingly, our framework employs robustness and reliability while treatment latency, cost, and need for direct involvement of healthcare providers. Our work is validated using 3 state-of-the-art datasets, naming Pima Indians Diabetes dataset, IMDs dataset, and Harvard Dataverse blood pressure datasets for experimentation and framework validation. Here in this figure, we show the workflow of our proposed phase framework. The framework has 3 main components: the knowledge base, optimizer, and checker. The knowledge base is the core component of the phase framework. 2 types of rules are stored in the knowledge base: the patient status inference rules and time series verification rules. The patient status inference rules are obtained from the healthcare domain experts and scientific research reports to map the patient's vital signs with a particular health status. On the other hand, the time series verification rules contain temporal relationship of the vital sign measurements. The latter helps identify abnormal sensor measurements due to fault or malicious intent. The optimizer takes patient status rules from the knowledge base and patient's vital sign measurements as input and thus produce an attack vector. The attack vector is represented by a minimal set of measurements to be added with the actual vital sign measurements for altering the patient's health status. The generated optimal attack vectors are passed to the checker for assessing the vulnerability of current patient vital sign measurements. The checker also takes the attacker's capability, patient's vital status inference rules, time series verification, current vital sign measurements into account to report whether the current set of measurements are vulnerable or not. The healthcare and cloud service providers will be notified immediately when the phrase framework reports the patient's sensor measurements to be vulnerable. We consider the measurements those as vulnerable measurements from which attack vectors can be obtained. The vulnerable measurements need special treatment to avoid the hazards. For evaluating our framework, we have collected data from multiple sources. We considered measurements from a state-of-the-art dataset, naming the Pima Indians Diabetes dataset, Although the dataset is not a time series patient diabetic status dataset, we leverage the dataset for rule acquisition and knowledge-based modeling. The Pima Indians dataset contains several features that are used for medical prediction, such that patient's age, insulin level, BMI, blood pressure, etc. And a target variable which basically shows the diabetes status of the patient. Among the features, the blood pressure, glucose, and insulin levels are the vital sign measurements that are considered for attack vector generation. We gather the personalized healthcare information from two time series datasets, naming the Harvard Dataverse dataset, which contains the blood pressure measurements, and the IMDs dataset, which contains the insulin and the glucose level measurements. These datasets are used for vulnerability analysis of the measurements collected from the Pima Indians Diabetes datasets. Here, we show the attack vector analysis for several cases. The table shows phase-generated attack vectors for 4 different cases. The demonstrated measurements are only vital sign measurements. We ignored the other dataset features such that the patient's age, number of pregnancies, etc., since those are out of our scope. In the first case, where the patient status is normal, and the fourth case, where the patient status is diabetic, the phase-generated attack vectors did not pass the verification test. Hence, these attack vectors are not considered as vulnerable. However, for the second case, the phase optimizer generated attack vector bypassed the verification module and is capable of altering the normal patient status to a diabetic one. In the third case, the attack vectors also evaded the verification rules and altered the diabetic patient status to normal. Hence, the attack vectors from the second and the third case are considered to be vulnerable. In these cases, the healthcare providers will be notified to perform further analysis of those scenarios to avoid wrong medication and treatment. The proposed framework also provides a guide to identifying the most crucial measurements to protect against measurement manipulation attacks. This figure shows various measurements' importance through their participation in the attack vectors. For instance, the glucose measurement contributes the most to the identified attack vectors. In both samples, considered attack vectors and attack vectors associated with the vulnerable samples, the participation is above 50% for the glucose measurements. Hence, glucose is considered to be the most crucial measurements, protection of which will create a robust blood pressure monitoring and treatment of a smart healthcare system. The insulin measurements is the least contributing towards the patient status protection as reported by the phase-generated attack vector analysis. The vulnerable samples are generated considering attackers have accessibility to all measurements. We assess the scalability of the phase framework through execution time analysis, varying the considered smart healthcare size. Although we had 3 vital sign measurements, such that the blood pressure, glucose, and insulin level measurements, we considered 3 different sizes of a smart healthcare system, where in the first case we portray rules only from glucose measurements. In the second case, we depict rules from 2 measurements, naming the glucose and blood pressure measurements. In the third case, we contemplate rules from all 3 measurements. The figure shows that the execution time needed for the phase optimizer is near about 2 seconds, 8 seconds, and 33 seconds for 1, 2, and 3 measurements respectively. The vulnerability checking time is negligible, such that less than 1 second for all considered cases. Although the figure shows a sharp increment in execution time, when smart healthcare system size increases to 3 measurements from 2 measurements, the proposed framework should be able to identify vulnerable runtime measurements for a large smart healthcare system which contain not more than 10 measurements. Hence, the framework seems to be scalable in a smart healthcare system concept. In this work, we propose phase framework for real-time security analysis of personalized healthcare system. The framework can generate sophisticated attack vectors with minimal alteration of measurements in real time to alter the patient's health status. Moreover, the deployed checker that uses vulnerable rules to detect abnormalities can reveal the attack vectors. We evaluate the proposed framework with several metrics. Our experimental analysis shows that more than 75% of Pima Indians Diabetes dataset data are robust against measurement manipulation attacks when face-generated verification rules are applied. In this work, we acquire the knowledge-based rules through data analysis from different state-of-the-art datasets. We plan to collaborate with domain experts to model the knowledge-based rules in future work. The verification rules are represented with minimum and maximum values. The future extension will consider predicted measurements confidence for reducing the vulnerable samples and thus contribute to enhancing the robustness of the smart healthcare system. Moreover, the verification rules used in this work will be modified in the upcoming work for further reduction in vulnerable measurements. Thank you so much for listening. If you have any questions, confusions, or queries, please let me know. I'll be happy to answer.